So I'd like to welcome our guest of honor, Ambassadora Claudia Ivette Canjura de Centeno. Welcome. Bienvenidos. Ambassador Canjura holds a doctorate in medicine from the University of El Salvador and a master's of public health from the Universidad Centroamérica, José Simeón Cañas. She holds many other certifications, and the list is almost too long. We could go on for a long time about her numerous diplomas and certifications. She has extensive experience as a health professional in El Salvador. From 1995, she served as a medical intern in the National Hospital Network. Between 1998 and 2008, she was medical director of the business clinic of the Salvadoran Social Security Institute in the office of the mayor of San Salvador. And moving on into 2009, she joined the Ministry of Foreign Affairs as extraordinary and plenipotentiary ambassador to the Republic of Guatemala, a position that she held until October of 2012. And then she was also, from January 2011 to October 2012, she was Secretary General to the Association of Heads of Diplomatic Missions, and she was awarded the Declaration of the Grand Cross of the Order of Quetzal in Guatemala for this. She was then in El Salvador appointed the Extraordinary and Plenipotentiary Ambassador to the Russian Federation, and then in 2015 appointed to her current position as Extraordinary and Plenipotentiary Ambassador to the United States. So welcome and thank you very much, our honored guest, for being here.
So good morning, everybody. I want to thank you, the George Washington University, the opportunity of inviting me to this important conference. I want to thank everybody, especially all the executives from the Metropolitan Washington Council of Governments, the Regional Primary Care Coalition, Mr. Mark Edberg, the Director of Advanced Center for the Advancement of Immigrant Refugee Health, Mr. Ana Gonzalez Barrera, the Research Associate of the Research Center, and all the students, friends that are with us in this morning. I'm so very pleased to be here. I'm the ambassador from El Salvador. I just came just a few months. I came on June. I present my letters of credence to Mr. President Obama the 27th of June. But I'm very happy to be in this country, and I'm very happy to be here. As you heard before, I am a doctor. I have a PhD in public health. I get it both in my country. So I'm used to work hard. I'm used to work beside with my people. We think that's the only way we can make things better, to get a better society, and to give better contribution to our country. So good morning. I'm very happy to be here in this important conference where committed individuals and organizations address health issues on Latin American community. Looking forward to ease disparities and concern about the impact of policies in our migrant communities. As one of the largest migrant community in this country, the Salvadorian population faces a big challenge to have access to health services, either for the status of their economic possibility. This makes them more vulnerable because they've got very few options the health coverage. All human beings should be able to achieve health care. That's just a right, regardless the nationality or immigration status. And from the government, we must seek for the realization of the right to health for irregular immigrants, returnees, and families left behind communities of origin. Because having a good health does not rely only on the ability or willingness of the migrants to obtain health care service, but is determined by external factors such as the availability of health service nearby and free for affordable assistance for people with irregular immigration status. So irregular immigrants have not legal status and therefore are much vulnerable to exploitation and discrimination in key areas of social life. And this affects this mental and this physical health, in addition to those health problems they might have and that are not well known or understood in these countries of residence, which face a big challenge when it comes to ensure that all migrants are able to realize their fundamental right to health. The right of everyone to the enjoyment of health has been established in international human rights law. Addressing migrant rights of health requires active collaboration across different sectors and actors and close cooperation between government, such as the organizations that are present here today. El Salvador is making his own implementing a comprehensive health reform which is based on primary care, prevention, and public health. Hundreds of new clinics which are staffed by community health team that they are known by as ECOs has been established in the poorest area of the country. Thanks to this reform, medicine, clinical visit, special services, and hospitalization through the Ministry of Health, which serves almost the 90% of the population, and all those services are free. For the returnees, we have established an assistance center in all our country that offer them the health and psychological care. We also are designing a plan to offer health care alternatives to those Salvadorians abroad that can travel to our country so that can get the medical consultation, treatments, and medications in our country, but not all of our citizens that live in the United States can afford the travel, and many of them due to their immigration status. That's one of the reasons why having an universal health as our principle, the Salvadorian government is willing to work with organizations that are committed to improving our community access to quality and affordable health in the United States. So I'm just here to tell you that I'm really committed with this program, with the health of my people. So whatever you can invite me or you can choose and decide to invite us to work with, we will be there. Even though we have a big community, but we have also a big organization with our community. So we can share with you our experience and of course establish with you some cooperation so that you can help us in our programs. We know we have big deals to resolve, and maybe we can't do it alone. We know about our concerns, and we know that there are other people as you that know what are our challenges. So whatever you want to cooperate with us, we've just working and waiting for an invitation so we can work together to help us. That being said, we hope this space become an opportunity to get together for improving Salvadorian and Latinos family quality life in this country, and for expanding those programs already in operation that increase the opportunities for our population to gain access to health service. Thank you very much for inviting me to this space. I'm very happy to be here, and maybe we can talk together later. Thank you very much.